The Certified Wealth Strategist presents Tactical Strategies Now podcast series. Do high net worth clients need long-term health care? In the next few minutes, Jeff Cobb, with over 17 years experience as a wealth advisor in the insurance industry, will share with you some valuable strategies and information that you can use right now with your clients.
True advisors are committed to providing their clients with comprehensive wealth management. This includes managing planning risks such as dying too soon, becoming disabled, or living too long. For high net worth clients, the living too long planning risk should include a conversation around long-term care. Even these clients have to face the fact that they'll probably need some type of long-term care during their lifetimes. Furthermore, there's no denying that long-term care is expensive and getting more so every year. The issue often boils down to whether high net worth clients can afford to self-insure the risk or should they purchase long-term care insurance. Here are some basics you need to know to help clients address that issue. Issue number one, what is long-term care? A good way to think of long-term care is to distinguish it from acute care. Acute care is administered by a healthcare professional for a relatively short duration, and it's intended to save a life or treat a specific disease or injury. Long-term care is usually not focused on medical treatment, but to help with activities of daily living, or ADLs, such as bathing, dressing, eating, or transferring from place to place. In addition, long-term care can be associated with cognitive impairment due to illnesses such as Alzheimer's, Parkinson's disease, or needs arising from a stroke. It may be administered by a healthcare professional, but in some instances, it's administered by paraprofessionals or even family members. Issue number two, what's the chance of needing long-term care? One widely quoted statistic from the U.S. Department of Health and Human Services indicates that 70% of the people aged 65 and over will need some type of long-term care before they die. Individual factors that increase the risk of needing long-term care are age, the risk generally increases with age, marital status, single clients are more likely to need care from a paid provider, gender, women are at a higher risk from men primarily because they tend to live longer, lifestyle, poor diet and exercise habits can increase risk, and family and health history, a personal history of ill health or family history of diseases or disabilities associated with long-term care increase the risk. The fact is that most clients will need long-term care, and it's an advisor's responsibility to discuss the potential impact. One way to think of it is this. If you knew that 70% of your clients aged 65 and older were likely to be subjected to an expensive liability lawsuit in the next 15 years, you'd make sure to address that risk. Long-term care is no different. Issue number three, what does long-term care cost? The cost of long-term care depends primarily on two factors, the duration of the care and the type of care. On average, someone aged 65 today will need some long-term care services for about 3 years. Service and support needs vary from one person to the next and often change over time. Women typically need care longer, about 3.7 years, than men, about 2.2 years. While about 1/3 of today's 65-year-olds may never need long-term care services, about 20% of them will need care for more than 5 years. As for cost, according to the U.S. government, the average cost in the United States in 2008 were $187 a day for a semi-private room in a nursing home, $209 a day for a private room in a nursing home, about $3,000 a month for care in an assisted living facility, about $29 an hour for a home health aide, around $18 an hour for homemaker services, and about $59 a day for care in an adult daycare center. In most cases, the type of care required varies over time. A client may start out needing homemaker services and then graduate to requiring a home health aide once or twice a week. Although most individuals requiring long-term care will see treatment in a nursing home for part of their care, the duration of the nursing home care is relatively short. Based on the estimated costs above, a full year's stay in a private nursing home would cost as much as $76,000 a year, based on the geographical location in the facility itself. However, when possible, most needing care would prefer to stay in the home and receive home care, and that costs even more. While this amount is probably not going to upset the wealth distribution plans of most high net worth clients, a longer duration of care could. Also keep in mind that long-term care costs, like other health care costs, continue to rise at double-digit rates. Assuming the increase of just 10% annually, costs could double in 7 years, about the time that many clients currently in their mid-60s will begin requiring some type of long-term care. Issue number 4, what are the alternatives to long-term care? For high net worth clients, the choices for paying for long-term care are likely to come down to self-insurance and commercial insurance. Self-insurance contemplates accumulating and earmarking certain assets or relying on already accumulated assets to pay for long-term care. This may be a viable solution for many clients, but be sure to remind clients of the hidden costs of self-insurance. These costs include the financial cost of identifying and liquidating assets, wealth tied up in closely held business interests, real estate, art, jewelry, or antiques may prove especially difficult and costly to move quickly. Even marketable securities may pose concerns. As the recent financial downturn has taught us, the worst time to sell is when you have to sell. The emotional cost of the decision making. Self-insurance places additional burdens on the client's family members at the time when they least need it. Who will decide what assets to liquidate and how much to spend? Issue number 5, what considerations are there with long-term care insurance? Long-term care assures that the amount needed to pay the costs of long-term care will be available at the time when it's needed without liquidating assets. Here are a few guidelines to follow in recommending long-term care insurance. Work only with top-rated carriers. Check with ratings from AM Best, Moody's, and Standard & Poor's. Clearly discuss benefit period options. Nearly 90% of all people over age 65 who enter a nursing home stay fewer than 5 years. The longer the benefit period, the higher the premium of the policy. However, be sure and discuss benefit period alternatives and the cost differences. Consider a longer elimination period. High net worth clients can probably handle the cost of 3 or 4 months in a private nursing home without much difficulty. A policy with a 90-day elimination period is likely to cost about 15% less than one with a 30-day elimination period. Again, it doesn't make sense to pay for more than the client needs. Look for policy flexibility. Recommend policies that cover care not only in nursing homes, but also in assisted living facilities and, most importantly, at home. A home care benefit should include adult daycare, hospice services, and respite care. Scrutinize additional benefits. Adding inflation riders and premium refund features can be expensive. Yet at the same time, inflation could have a huge impact on cost when care is needed. Consider whether the benefit is really worth the additional cost. Finally, if you're not comfortable making recommendations about long-term care insurance, don't hesitate to call in a professional, someone who knows policy features and benefits inside and out. The bottom line, not all of your high net worth clients are candidates for long-term care insurance. However, all of your clients are candidates for a discussion about long-term care. How do they feel about it? How would they like to see things happen? How do they feel about liquidating valued assets to pay for long-term care? What would be the consequence if charitable gifts or family requests were diminished or eliminated due to long-term care costs? All are part of the discussion you should have with your clients.
This podcast was brought to you by the Certified Wealth Strategist. If you missed a previous podcast or would like to learn more about the fastest growing certification in the financial services industry, please visit www.certifiedwealthstrategist.com.